Tonsils. You have to know it theoretically. We don't have a slide, but you have to know it. You can, histology of palatine tonsils. That can come. Second thing is that it is a repetition. I think I took a lecture class in your in the hall. So it is just a repetition. তোমরা বসবে একটু ভাই একদম বেরিয়ে যেও না. Don't go out. Now, just revision, it's a revision, more or less a revision. Palatine tonsils, describe the palatine tonsils under the following headings: morphology, relations, blood supply, and applied anatomy. Palatine tonsils, commonly called tonsils, are a pair of almond-shaped masses of lymphoid tissue situated in the lateral wall of the oropharynx in the tonsillar fossa. The palatine tonsils are located in the basilar fossa, tonsillar fossa. The boundaries of the tonsillar fossa are as follows: anteriorly palatoglossal arch containing palatoglossus muscle, posteriorly palatopharyngeal arch containing palatopharyngeal muscle, apex soft palate, meeting point of both arches. This is the meeting point of both arches. This is soft hard palate, this is soft palate. Now, the base dorsal surface of the posterior 1/3 of the tongue, the dorsal surface of the posterior 1/3 of the tongue, laterally tonsillar bed. Now, see, this is the hard palate, this is the soft palate, this is the uvula, this is the palatopharyngeal arch, this is palatine tonsil, palatoglossal arch, tongue, and the palatine tonsils is here. Now, these are there's a section of the tonsil that gives a intratonsillar cleft, tonsillar crypts, and tonsillar pits. These are the muscles, the buccopharyngeal fascia, superficial constrictor, pharyngobasilar fascia, paratonsillar space, and this is the histological section. Now, again, it's a repetition: palatopharyngeal arch, soft palate, palatoglossal arch, uvula, palatine tonsils, posterior wall of the pharynx, dorsal surface of the posterior 1/3 of the tongue. See, lateral, now external features. The medial surface free, lined by non-keratinized stratified squamous epithelium, tonsillar pits, tonsillar crypts, intratonsillar cleft, lateral surface covered by capsule, anterior border related to the palatoglossal arch, posterior border related to the palatopharyngeal arch, upper pole reach soft palate, lower pole suspensory ligament of the tonsil. Now, supply, arterial supply, tonsillar branches of the facial artery, ascending palatine branches of the facial artery, dorsal lingual branches of the artery, ascending pharyngeal branches of the external carotid, greater palatine branches of the maxillary artery. The venous drainage, palatotonsillar vein, pharyngeal veins, lymphatic drainage, jugulo-digastric nodes, innervation, glossopharyngeal nerve, greater and lesser palatine branches, and palatopharyngeal ganglion. Now, pterygopalatine ganglion, clinical tonsillitis, tonsil stones, ear pain in tonsillitis, quinsy, tonsillectomy, post-operative hemorrhage in tonsillectomy. These are the main area you have to focus. Know the, pharynx, larynx, and the total aspect. Now, when you see the section of the your sagittal section, we have a specimen, and you can see that. First, you see your own tongue, and tonsillar bed and tonsils, just before the mirror. That you will, or you see your friends, you take a spoon and just depress the tongue, and you see the anatomy of the tonsil and the tonsillar bed and the some tonsils, if you among 10 you see in this weather and going to the inside a AC room and this thing, you might get a cold, a cough, and sometimes some have from this thing in the young age they get that tonsils. Still they have it large. If it doesn't say causes any problem, then you definitely get least bothered, but you keep your lifestyle management, that is the talk of the day and throughout the globe for any disease. Lifestyle management, you warm saline gargle, or and you going to the hills, you take a proper care of your winter clothes or anything, or even there's a heavy rain, temperatures falling down, this thing, run the AC in temperature 18, 16, 20. No, it's coming into such proportion that global warming and all, now the government is asking manufacturers not to have, they will be controlling up to 20, 29, 21. 21 say aapka lowest temperature will be 21 and moderate is 26 or 25. So you, when you are in practice, you try to give some this thing, your medicine, antibiotics and other analgesics for temperature, and and also you can give some cough syrup. Actually doesn't work as such so much, but you can give a lozenge. Lozenge means Vicks or your Honitus or Strepsils, these type of lozenges. That gives a soothing effect. Soothing effect. So you have to, when you treat a patient or a child, you have to be very careful and advise accordingly. Second thing, see, if the patient was treated with you, the mother complained of pyrexia, high pyrexia, but you have not seen the oral cavity. You have not seen the tonsil, and that might be an abscess, quinsy, and it takes just a second. If it is a small child, then you ask the mother for an ENT examination. But see, you will be practicing as an MBBS in the local clinic or some polyclinic or something. Actually, you are seeing that patient, you won't be referring to an ENT that day. You can please show an ENT after 5 days of my treatment. Because this is the thing. No, first day आप देख लिया, भेज दिया orthopedics को. Just not for ENT problem. Or it's having a small fracture or something like that, or you have an X-ray done, and if there is you give a support. Previous days we used to break cardboard and place it, or some solid wood, or your foot ruler, wooden rulers, scale. You put it and put a bandage, comfortable bandage with cotton and then crepe bandage to give a support, and put a sling. Now that gives the comfort to the patient, and also that bone is not going into then you refer to your orthopedics. So they pay you the fees for your service, and also you are giving comfort, and at least you give some analgesic. So I'll be a specialist, I won't say, no, isko dikhana hai udhar. Nahi, you at least for time being, because that infrastructure will take more than 500 years, 50 years or more. To every block, everywhere, there's a doctor, there's a hospital. But throughout the globe, COVID proved it, that there is a shortage of healthcare individuals. There is a shortage of doctors. So, healthcare givers. But your duty is, if you are a very good MBBS, be a good MBBS. Then you will automatically become a good postgraduate. Postgraduate is the thing that you are acquiring through studies, or I would rather say that postgraduate actually you through higher studies you are doing things, but it is an extended level of the MBBS. If a patient comes with edema and this thing, so immediately नहीं इसको refer कर दिया, refer करना है अब for the law, or why didn't you tell us you cannot manage? So for that you see, be very clear and tell the patient. Now I'm talking about holding a child. The mother will hold the child like this and put her in between the legs of the mother. The child will be fixed, and you take your this thing spatula, tongue depressor or tongue spatula, and you see the, if it's a small child, actually light will your he'll be in panic. You would try to immediately get your attendant to give a lollipop. The other day, 3.5 years kid, I did a hernia operation and hydrocele. But on the day he came to my chamber, which I just extended, hello, I extended my hand. And then we try to become friends. So he knows that, no, this person won't harm me, the child psychology. So similarly, you one Cadbury or one lollipop you give, to give it that child a comfort zone. And you'll be happy. Then don't wear a mask. Don't wear this thing because you put on mask or something when you're attending a child. So you just examine, and if you see there's a big swelling of this thing, then you definitely send to the hospital emergencies. If you cannot send it to your friend or your known person, but send it to your emergency. And assure the mother that don't worry, it will be okay, it will be settled. And all tonsils are not operated for. If it is giving some, creating some problem, then only you can, but you have to see, the trend, today's trend is that you have a PGD diploma, online diploma or something like that. You acquire that, but that doesn't, but many times you miss. They are missing many things in a hurry. When you see that child, you have to assure, because see, even see if there is a your blockage of cold and this thing, then you adults or young adolescent boys or this thing, to do just a maneuver, you just hold your nostrils. You take in the air and let it, then you hold it in your nostril and slowly release, because you get a ear block. Bad cold means ear block. You cannot hear that due to the pharyngotympanic tube, from the pharynx to the tympanum. Pharyngotympanic tube is lined by mucus and everything, cells, that goes into edema, and there is passage of sound and everything is a problem. So this maneuver you must, for adults or who can understand and perform this. A child cannot perform this. But you see, these are the small things that matters. It's not the antibiotic that matters, because he or she is over the counter, OTC. Many tablets and drugs are in the OTC, and they take in some antibiotic, take in some thing. You just write A. You're writing, I'm the patient. You're writing A. Sir, azithrol খেয়েছি. For PPI acidity, I'm writing R. Rantac খেয়েছি. So people are knowing that I have taken this medicine. They have not gone to the doctor. Then when there's a big problem, they come to the doctor. Am I clear? Now, the tonsils, that means, and the operation for the tonsils, a tonsillectomy, and now see, now the thing is that in ENT practice or anything, the gadgets, endoscope, the ENT, this thing, they go for any maneuvers through the nose, they can put in the endoscope. For tonsils, even they can see the thing. And lower down, they see. And they are doing it in my, one of my juniors, Professor Manoj Mukherjee, he's in from my college, Bardhaman Medical College. He does a fantastic endoscopy. So there is a small machine you just put in and see the picture, the situation. And of course, in kids or children, they'll be, you have to anesthetize. Now, these are the things you have to remember, that your good MBBS is a good postgraduate. See, one thing, that is a book written by Professor S.K. Dey, ENT book, that 80% photographs are mine. When I was a student in Bardhaman Medical College, I used to carry cameras in my bag. Not this type of bag, it's a jhola, toto bag. It's like a toto bag, designed by me. For keeping notebooks, pencils and rubbers and everything. And another toto bag I had my camera. So Professor S.K. Dey requested me, hey, তুমি আমাদের ছবি তুলে দেবেন আমার? Sir, এটা এরকম করে বলবেন কেন? So I had the opportunity to take the photographs for him. The child holding that photograph, everything is there. Professor S.K. Dey, ENT. Okay, now it is the, you please sit down. ওটা খালি রিভিশন করো, বই দেখো, হ্যাঁ, একটু বই দেখে নাও, ফোন দেখে নাও, ট্যাব দেখে নাও,